Have you ever stopped to think about what really happens to your body when you decide to go 30 days without ejaculating? Sounds crazy, right? But what if I told you this simple decision can completely change how your penis responds, the quality of your erection, and even the intensity of your sexual desire? Sex and masturbation are part of every man's life, but few understand what happens inside the body when you break that cycle. And that's what I want to talk to you about now. Without taboos, without beating around the bush, and based on what science actually shows. When a man goes days without ejaculating, something interesting starts to happen. The brain, used to the constant release of dopamine and prolactin, enters a state of adaptation. The body starts reacting differently, and the penis, yes, your penis, becomes the center of a series of physiological and mental changes. It's as if the body said, "Hold on, what's going on here?" Blood flow behaves differently, testosterone levels fluctuate, and even mood can be affected. Some men report more energy, others feel irritable. But what's fact and what's myth? That's exactly what we're going to explore together. I'm Emily Collins, a urologist, and in recent years I've closely followed men who decided to challenge their own bodies and discovered surprising results. I'm not here to tell you what to do with your sex life, but to help you understand what really happens when you change the pattern. Because, believe me, sexual health isn't just about sex. It's about self-knowledge, balance, and understanding your own body. And now I want you to run a quick test. Look at yourself and think, how long has it been since you truly paid attention to what your body is trying to tell you? Could your penis be sending signals you've been ignoring? In the next few minutes, I'm going to show you what science says about the real effects of going 30 days without ejaculating, and what this can reveal about your health, your desire, and even your mind. But before we continue, make sure you already subscribe to the channel. That way you won't miss any upcoming videos on men's sexual health. And tell me in the comments, have you ever tried going a period without ejaculating? What did you feel? I want to hear your experience. When we talk about ejaculation, it is striking how most men know the end result, but almost no one understands the process happening inside the body. Behind a few seconds of pleasure is a complex symphony of chemical reactions, electrical impulses, and hormonal responses. It all starts in the brain. That's where desire is sparked, when a visual, tactile, or even emotional stimulus activates regions responsible for libido. From there, the command travels down the spinal cord and reaches the penis, activating the nerves responsible for erection and semen release. During sex or masturbation, the body works in harmony. Blood vessels dilate, the penis hardens, the heart speeds up, and dopamine levels spike. It's the neurotransmitter of pleasure, the one that makes you feel rewarded. Right after ejaculation, another hormone takes the stage, prolactin. It's responsible for the feeling of relaxation, but also for the momentary drop in desire. That's why, right after orgasm, the body asks for a break. When this cycle is repeated frequently, it creates a kind of stimulus pattern that the brain comes to expect, like a quick, predictable reward. Now, when you decide to interrupt this cycle, when you go days without ejaculating, the body reacts in a curious way. The brain begins gradually reducing sensitivity to automatic stimuli and recalibrating the dopaminergic response. It's as if the body were rediscovering its own ability to generate pleasure without relying on immediate release. Some men report increased focus, energy, and self-confidence. Others feel discomfort and anxiety, which is natural. The absence of ejaculation causes the body to store more sperm, and the prostate can feel that internal pressure, triggering different sensations in the pelvic region. But here's an important detail few talk about. The effect isn't just physical. The relationship between the brain and the penis runs deeper than it seems. When the body is deprived of sexual release for a period, the brain begins reacting more intensely to real stimuli: touch, contact, scent, eye contact. This means that when you resume sexual activity after some time, pleasure may be more intense, the erection firmer, and the sensitivity different. But do these benefits really hold up? Or is the body just temporarily adapting to a new hormonal pattern? In the next few minutes, we're going to go even deeper into this question. I want to show you what actually changes in your penis, your erection, and your body's overall functioning when you spend some time without ejaculating. From here on, the conversation gets even more interesting, because this is where science starts showing results many men never imagine. When a man decides to go days or even weeks without ejaculating, the body enters an adaptive state that few perceive consciously. The penis, which normally responds quickly to physical or mental stimuli, starts reacting differently. Some report more intense, firmer erections and even increased sensitivity. Others, by contrast, notice a feeling of tension, as if the body were asking to release what's been building up. And the truth is, both are right, because it all depends on how the body reacts to retention. In the first days without ejaculation, there's a slight increase in circulating testosterone levels. The body interprets the absence of sexual release as a signal that it needs to produce more hormone to keep the system active. This can result in stronger erections, increased desire, and even a heightened sense of virility. But this effect is temporary, and it isn't the same for everyone. Testosterone tends to stabilize after about a week, and the balance between desire and self-control becomes the new challenge. Physiologically, the penis continues to receive blood, and spontaneous erections, the ones that happen during sleep or upon waking, become more frequent. They're the body's natural mechanism to maintain penile health. When you spend some time without ejaculating, the body ensures these erections to oxygenate tissues and prevent loss of elasticity in the corpora cavernosa. It's a reminder that erection isn't just pleasure, it's also health. Blood flow keeps the tissue alive, nourished, and ready to respond when needed. But there's a point where retention can start to cause discomfort. The accumulation of sperm in the ducts and prostate can cause a feeling of heaviness, mild pain, or even uncomfortable pelvic pressure. Some men describe it as a kind of internal fullness, a sign the body wants to release. And this is where balance needs to be understood. Abstinence can be beneficial for a while, but too much can lead to stagnation and even prostate inflammation. At the same time, many men report something curious: a more responsive erection to touch and emotional stimulus. This happens because the brain begins to value pleasure differently. Physical sensitivity increases, and desire reconnects with emotion, something that's lost when pleasure is treated only as an automatic habit. And this is where abstinence reveals its most interesting side. It can reconnect a man with his own body and restore control over pleasure. But what happens in the mind when the body enters this state of restraint? Does desire turn into energy, into focus, or does it build into frustration? That's what I want to show you next, because the psychological side is as powerful as the physical. And often, it's what determines whether the experience will be liberating or a torment. Now that we understand what happens physically, it's time to look inward. Because the mind is, without a doubt, the most affected field when a man decides to stop ejaculating. And here begins the real transformation. The first days can be challenging. The brain, accustomed to the quick reward of pleasure, starts to demand it. Dopamine, which used to rise and fall in instant spikes, begins fluctuating irregularly, and this triggers restlessness, irritability, and an almost instinctive urge to break the fast. This is the moment many give up, not realizing they're at the point where change truly begins. As days pass, mental control gains strength. A man starts realizing he isn't a slave to impulse. The simple act of resisting immediate desire reorganizes brain circuits, strengthening areas linked to focus, discipline, and self-confidence. It's not just about holding back, it's about redirecting energy. What was previously spent automatically begins to be perceived as vital energy, and that energy can manifest in many ways. More drive for work, increased concentration, better mood, and even a stronger presence. But attention. This effect doesn't come from the magic of not ejaculating. It comes from conscious awareness of your own body. When a man becomes more attentive to his desire, he starts to understand his triggers. He learns to recognize when pleasure is genuine and when it's just escape or habit. That's where self-control turns into power. Desire doesn't disappear, it becomes refined. The urge to seek pleasure stops being compulsive and becomes a choice. That's true sexual freedom. Some men report feeling more confident when interacting with others, especially partners. It's as if inner self-control reflects outwardly. This shift in energy is noticeable, not because there's a mystical aura, but because behavior changes. The gaze is steadier, the body more relaxed, the mind more centered. When you stop chasing immediate pleasure, you start living the pleasure of being present. But there are challenges too. Retention can trigger more intense fantasies, erotic dreams, and heightened mental sensitivity. That's normal. The brain is trying to balance accumulated desire. The key is to use that energy consciously, channeling it toward goals, real connections, and not just momentary relief. And this is exactly where the biggest confusions arise, the line between psychological benefit and myth. In recent years, NoFap has become a kind of global movement. Thousands of men swear that stopping masturbation and ejaculation completely changed their lives. More energy, more focus, more confidence, stronger erections. And while there are sincere reports and real results, we need to be careful. Because along with knowledge came many myths, and that's what we need to discuss clearly and without fantasies. Seminal retention, medically speaking, isn't a supernatural power. It won't turn anyone into an alpha or a being of unlimited energy. What really happens is a chemical and mental reorganization. When you step away from constant stimulus, especially the artificial stimulus of pornography and automatic masturbation, the brain relearns how to react to natural pleasure. It rediscovers the intensity of touch, real contact, eye connection. That, yes, changes your relationship with sex. It's not magic. It's neurological re-education. On the other hand, there is a dangerous point. Many men go into total abstinence believing they should never ejaculate again. And that can have the opposite effect: anxiety, irritability, insomnia, and even testicular pain. Semen is a natural product of the body, and the reproductive system needs to function in balance. There's nothing wrong with ejaculating as long as it happens consciously. The key is understanding the difference between conscious pleasure and addiction to pleasure. Another widespread myth is that retaining semen for weeks makes the body reabsorb vital energy or permanently raises testosterone. Science shows that there are mild hormonal variations during abstinence, but nothing lasting. What really changes is the mental state. A man starts feeling more in control, more self-possessed. That perception breeds self-confidence, and self-confidence, in turn, directly affects sexual performance. In other words, the power isn't in retention itself, but in how you interpret it. Retention can indeed be a powerful tool for self-knowledge. It forces a man to face his impulses, to realize how much he was being controlled by them. That goes far beyond biology. It has a psychological process and even a spiritual one for some. But turning it into dogma, a rigid rule, is falling into another extreme. And whenever the body is pushed to extremes, it always pushes back. That's why the real secret isn't about stopping ejaculation. It's about understanding why you do what you do. Masturbation isn't the enemy, lack of control is, and retention isn't a prison, it's a tool. The balance between these two forces is what defines a healthy, conscious, and fulfilling sex life. Now, what happens when that balance is lost? When a man takes abstinence too far, ignoring his body's own signals? When the practice stops being beneficial and starts causing harm, and that's what we are going to talk about next. Everything done in excess, even what seems healthy, can become harmful. Sexual abstinence is no exception. Going a while without ejaculating can bring temporary benefits, but when it becomes an obsession or a rigid goal, the body begins to fight back. Long-term semen retention was never meant to last indefinitely. The male reproductive system is dynamic, constantly producing. And when that production has no outlet, the body gives clear signals that something's off balance. The first symptom is discomfort. Many men report a feeling of heaviness in the testicles, pelvic pressure, or even mild pain. That happens because sperm keeps being produced and stored in the prostate and seminal ducts. Over time, this can cause prostate inflammation, known as prostatic congestion, which comes with mild pain, frequent urination, and the feeling that something is stuck. Ignoring these signs is dangerous. The body is asking to function. Beyond physical symptoms, there are mental ones too. A man trying to suppress desire for long periods may experience psychological tension. The brain enters a state of conflict. On one side, the natural urge to release. On the other, the rigidity of a self-imposed goal. This internal battle can cause anxiety, irritability, lack of focus, and, ironically, erectile dysfunction. Yes, the very man trying to improve his performance might end up harming it by trying to control his body too much. Another risk lies in how pleasure becomes perceived. Constant repression can create guilt and distort one's relationship with sexuality. Masturbation and sex stop being natural experiences and become moral dilemmas. That's not balance. That's imprisonment. Male sexual health depends on harmony between body and mind, and any practice that causes guilt or suffering isn't healthy. Retention can be used as a tool for awareness, but never as a cage. True self-control is knowing when to stop, but also when to let go. When a man understands his body, he no longer fights it. He cooperates with it. That's the moment when the practice stops being about abstinence and becomes about self-knowledge. In the next few minutes, I'll show you how to find that point of balance. How to turn what you've learned about your body into real power over your sex life without guilt, without extremes, and with genuine pleasure. Because knowing your limits isn't weakness, it's wisdom. And that's what we'll talk about in the final part of this video. After everything we've discussed, maybe you've realized that the real question isn't whether to stop ejaculating, but why you make each choice you do with your body. Male sexuality has been surrounded by so many myths, guilt, and expectations that many men have lost touch with what truly matters: self-awareness. Going 30 days without ejaculating can be a transformative experience, not because there is a hidden biological secret, but because it forces you to look inward and see how much your impulses and habits have been in control. When you learn to observe your own desire, something shifts deeply. Erections stop being just physical responses. They become a language of the body, a sign of vitality, presence, and connection to pleasure. The penis stops being a source of anxiety and becomes an ally, a reflection of balance between body and mind. That's what true sexual health is. Not about power, but awareness. Science shows that men who have a healthy relationship with their own pleasure live better, experience less stress, and enjoy more stable sexual performance. It's not abstinence that heals, it's balance. Knowing when to hold back and when to allow is what keeps both the body and mind in harmony. Retention, when practiced wisely, teaches discipline. Release, when done consciously, brings relief and well-being. Between the two lies the point of harmony, and that's where true masculine power resides. I'm Dr. Emily Collins, urologist, and my goal is to help you understand that sexual health is not taboo. It is self-care. Talking about the penis, erections, masturbation, and pleasure isn't shameful. It's knowledge. And knowledge is what separates confusion from freedom. So, next time you think about changing your sexual routine, remember, your body is always sending you signals. You just have to listen. If you've made it this far, congratulations. That shows you care about your health and want to be a better man, more conscious and connected with your own body. Now, help me spread this message. Subscribe to the channel, leave a like, and turn on notifications so you don't miss upcoming videos. And tell me in the comments, do you believe balance is the real secret to male potency? I want to hear your thoughts. And for you who stayed until the end, the next video is on screen right now. Click and discover more about how to take care of your intimate health in a smart, natural way. Because self-awareness is the first step toward a full and lasting sex life.